Between 2015 and 2023, over 500,000 South Africans died of TB. And in 2023 alone, 1 in 5 people succumbed. That's a case fatality rate of 22%, amounting to 56,000 deaths of the 270,000 infections. TB-related deaths among people living with HIV have declined by 31%, but regrettably, TB deaths among those without HIV increased by 25% over the same period. The human cost extends beyond lives, as more than half of households affected by TB face catastrophic costs, demonstrating that TB continues to exacerbate poverty as well as illness. TB treatment coverage is improving, with 79% of the 270,000 people which you have mentioned with TB in the country identified and treated as of 2023. We continue to intensify our efforts to detect new cases and close this gap. To end TB, we must identify all individuals living with the disease, treat them, and most importantly, cure them. This will help break the chain of transmission in our communities. Treatment success, standard drug-resistant TB, now stands at 83%, while success rate for the 6-month regime for multi-drug-resistant TB ranges between 75 and 80%. Loss to follow-up remains a challenge, with 8% of patients with drug-sensitive TB and 9% of those with drug-resistant TB discontinue treatment. Children and young adolescents are of a particular concern. They are significantly underrepresented in the TB notifications, accounting only for 10% of all cases. Honorable members, despite the challenges that we have outlined, we are also making noteworthy strides. The National TB Program, through the TB Strategic Plan, Annual TB Recovery Plan, and Targeted Universal Testing for TB approach, continues to maintain focus on TB to ensure we do not falter. We have established a multi-sectoral TB technical task team, coordinated by SANAC, which leads the work of TB technical working groups, comprising all of government departments, civil society, the private sector, and development partners, such as the World Health Organization. To accelerate progress, in February 2025, the National Department of Health launched the NTB campaign, which aims to screen and test 5 million people for TB annually. The campaign integrates TB screening into routine monitoring and evaluation meetings across provinces, ensure coordination with national HIV response. To track progress, honorable members, last week on Friday, we launched what we call a public-facing NTB campaign dashboard. This dashboard enables provinces, partners, civil society, and the public to monitor testing, treatment, and outcomes in near real time. It serves as a tool for transparency, accountability, and action,